My name is Dr. Goodman. I'm the veterinarian here at the zoo. I'm here with Abby. She's one of our veterinary technicians. And today we're going to get some footage for you guys of Pickle's annual exam. So most of our animals here get a hands-on veterinary exam every single year. So today you're going to join us for Pickle's exam. So now we're going to move around to the rest of his face. We're going to look in both of his nostrils. And we're going to check his teeth. So Pickles is about 20 years old here. So we can look and make sure that his teeth look nice and healthy and that his gums look healthy, which they do. You have a little bit of plaque on your teeth, sir. So now we're going to listen to Pickles' heart, lungs, and GI tract, and then we're going to take his temperature. So we want to make sure that we listen to his heart on both sides of his chest so that we can hear all of the valves in his heart pumping. Donkeys have a much slower heart rate than we do. Pickles' heart rate is around 36 beats per minute, which is normal. And we're going to listen to his chest so that we can hear his lungs and make sure that they are also healthy. Again, we want to do that on both sides of his chest. You can also listen to his trachea and make sure that air is moving into his lungs normally. Horses and donkeys are hindgut fermenters, so we want to listen to his GI tract in multiple areas and make sure that he's digesting all of his hay and straw properly. Good, Pickles. And then we're gonna get Pickles' temperature. So unfortunately for Pickles, we have to put a thermometer inside his rectum or butt in order to get an accurate temperature reading. So we wanna make sure the thermometer is nice and lubricated. Come here, sir. Oh, what a good boy. Good job, Pickles. So today his temperature is 97.9 degrees, which is a good temperature for a donkey. Then we want to move and look at all of his feet and hooves. So I want to see if I can feel pulses in his distal limbs, kind of where the hoof meets the leg. That can be a sign of inflammation if he has bounding pulses. We also want to make sure the temperature of his hoof is normal and symmetrical across all four of his hooves. And then we'll do the two back hooves. So again, we're just feeling for any pulses that could indicate some inflammation. And then checking the temperature of the hoof wall. So everything feels good. Now we're gonna move on to getting a blood sample and giving him some vaccine. So the next part of Pickles' annual exam is going to be to collect a blood sample. So Abby is gonna show you guys how we do that.
Anybody, little poke. Okay. No wiggles. Pickles, please don't fall. Oh, you're okay. Getting blood. There we go, buddy. Good job.
All right, and then she's gonna hold off on the vein for a minute, and then you're gonna see her put his blood sample into different types of tubes, which is just like you guys have happen at the doctor's, so that we can get all the tests that we normally do for him every year. Just like you guys have when you go to the doctor, Pickles needs some of his shots. So today he's gonna get a vaccine for some of the mosquito-borne diseases in this area, like West Nile virus and Eastern equine encephalitis. And then the vaccine also includes a tetanus booster for him. So we're just going to give him a little poke underneath his skin in the rear end. Good boy. And see how brave he was? Great job, Pickles. So today, while we're doing Jenny's physical exam here, we want to take a good look at her nostrils and her teeth to make sure that everything looks healthy and normal. So we're just gonna get a quick peek at her nostrils, and then we're gonna look at her teeth. Make sure that there's no abnormalities, that her gum tissue looks nice and healthy, that her tongue is nice and pink. Good girl, Jenny. Everything looks good. There you go.
All right, Jen.
Hi, so I'm Ian. I'm a keeper here at Elmwood Park Zoo. I'm along with Courtney, one of our vet techs, and we're going to be giving Jenny a hoof trim using our hoof pick and brush, and also this rasp, which is like a jumbo nail file. Here we go. So Jenny and Pickles, our miniature donkeys, are real good about offering their hooves as soon as we touch, and you see she just lifted it up. If you're looking in there, you can see we got a lot of gunk that we're going to clean out. Just animal waste and straw and hay. We want to pick around in here kind of like we're exposing a fossil. And then we're going to look at the hoof. See that it's making contact across the whole bottom here. And it appears that we can take away a little off this with our rasp. We want to make sure that the frog, which is this portion, is making contact with the ground. If the hoof gets too long, that doesn't happen. There we go, looking good. And then I'll just clean up the tips there. And that is a good looking hoof. We're gonna move on to the back hoof here. And again, first we're gonna pick out all this gunk. And you can see she's really good about offering up her hoof. We pick their hooves daily here, so it's something she's pretty acclimated to. So this doesn't hurt them at all. It's just like if we were cutting our fingernails at home. We don't experience any pain from that. They don't experience any pain from this. Notice I do wear a glove though, because unlike their hoof, my finger would hurt if I were to rasp that. So this one is looking good. Clean up the edges here. Excellent job, Jenny.
So today Jenny is going to get some of her vaccines that she gets every year. Today we're going to give her a vaccine against clostridial disease that's called botulism. So we're just going to give her a little injection. Oh, you're so good. And that is it.